Hi, so today we're doing a visit called Review Findings. So this is just going to go over some of the things that I found and what I think is going on and where we're going to go from here. So first I just want to go over a few things in the history, just make sure that, I did get all the facts right. So you started getting left knee pain gradually about 2 weeks ago. You've never experienced this pain before. And you also have started training for a half marathon about 8 weeks ago. Your pain is worse when you go upstairs or when you start running longer than about a mile and a half. You also have pain. It gets worse when you go upstairs or you do run longer than that 1.5 miles, and that's more of a sharp pain. But then you're also getting worse pain when you're sitting for long periods of time. That's more of an achy pain. So I know when I asked you to point out the pain, you pointed like directly in front of that kneecap, and you gave it a scale about a 5 out of 10. So I know that it's really concerning for you because you said that you had an aunt that had knee pain and it ended up having her getting surgery. And I know you want to complete that half marathon, and I know you don't want to get surgery, so I'm glad you came in. I also do think it's amazing that you signed up for this half marathon with your roommate. It's going to be so rewarding when you go through that finish line, and you guys are going to get great memories together. So after putting all the puzzle pieces together from the history and from the exam, and hearing that you bumped up your running from about 5 to 7 miles per week to about 15 because of training, I think it's something that we call chondromalacia patella. So this is softening or wearing down of the tissues that are right behind that kneecap. You also can get pain and some of that grinding from that big thigh bone that you have when it starts rubbing against your kneecap. And you actually can see this about 36.2% in the general population, so you are not alone in this. So, on average, it should take about 21 days if you're getting treatment. I know that you're going to still want to train, and you're going to have to sit and run and maybe do some of these things that do irritate it, so it could possibly take longer than that. But on average, it takes about 21 days. I also want to point out that according to the International Patellofemoral Research Center, that the key treatment of this chondromalacia patella is exercise therapy and physical intervention, which we can do right here in office. So some things that we can do in office for us, like I said, we can work on some exercises, strengthening some muscles in your glutes and in your thighs and things that surround that kneecap. To help give it more stability. It's also muscles that you use a lot when running, and if it is like an endurance thing, that we can strengthen those and should help decrease pain. We can also do things like taping. Now, I would really only like to tape when you're going on like long runs or right before your race. Taping is great to kind of bring more proprioception, so it's letting your body know that, hey, there's something going on, in this area, and actually sends signals to your body to say, hey, there's something going on. We need to fix it. It also has been seen to help kind of support that area. So it does help relieve that knee pain when you are going on long runs and things like that. Now, I would not like to have that taped every day because I don't want you to become dependent on it. But it is some option that we can do, and I can show you how to do it in here in office. That way you can do it on your own before that big race, or you can come in and I can do that for you. Also, things we can go over is gait. So that is how your body is moving when you're walking, jogging, and running. That plays a big role in what muscles are being activated, how that bone is rubbing on that patella due to the motions of your body. Also, we can go over proper footwear. This is so important when it comes to your gait and how you run and how your feet land, and things like that. That could be contributing to your knee pain. Is there any questions, any concerns, questions about treatment and where we go from here? Perfect. All right.